I think that it is a real mistake for people to feel ashamed of their drug addiction. Drug addiction is a chronic illness. It is like diabetes, it is like hypertension. And yet our society looks down on drug addicts in a big way. They should look down on people who have hypertension. They should look down on people who have diabetes. After all, if you have a tendency for diabetes and if you eat very little food, if you practically starve yourself, if you never drink a soda, if you never take anything with sugar, you may become very thin and run down and weak, but you could actually control a lot of your diabetes by doing that. But is that correct? There are medications to treat it. You can lead a normal life and you can be relatively stable with your blood sugar. It's the same thing with addiction. You cannot just snap out of it. Or, as one famous president's wife said, just say no. If it were so simple, then everybody would do it. People are very ill, and it is a serious illness that has a biological, psychological, and a social component. Unless we first accept that it is an illness, it is never going to get better. But once we come to the acceptance that it is beyond someone's control, just as diabetes or hypertension, we can at least proceed with the treatment. And the treatment consists of treating all those three aspects: the biological with medicine, the psychological with medicine and psychotherapy, and the social by integrating the family, helping the person change their environment and their friends, throwing away the cell phone with the old numbers, and starting a new life. It is a chronic illness that needs long-term treatment, just like diabetes and hypertension. You need to find a good doctor who you trust. You need to take your medicine regularly, and you need to follow through with the treatment that is prescribed for you. Each person is different, just like diabetes and hypertension, and needs a different type of treatment.